Welcome to the Rural Doc Allen podcast. We're excited to welcome the program Rural Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
We're doing fantastic, and today's topic is external cephalic version. What is external cephalic version?
Well, cephalic means head, version means turning, external means from the outside. So this means to turn a baby from like a head up to head down, or from a head on the side to head down. It's like a forward somersault for me, and it's a nice alternative to a breech delivery or a C-section.
Why do an external cephalic version?
Well, it is a very good option. It's the third option. You can deliver a breech, at least I can. And if mom is invested in a breech, it's a relatively simple thing. Also, of course, you can do a cesarean section for a breech, or you can turn the baby's head down to make it head first.
When should an ECV be done?
Well, you're right. ECV is a lot easier to say than external cephalic version. But today, external cephalic version is done 37, 38, or 39 weeks. And we've changed that. Years ago, we would do the turning in the office at 32, 33, 34 weeks. The problem with that is that we found that a lot of those babies would turn back again to breech. Also, if you just leave them alone, about 2/3 of them will turn head first all on their own. So if you can manage to avoid the problem of doing the version, you save mom some risk.
How should an ECV be done?
Well, like I said, it used to be done at 33 weeks, but of course now when their babies are bigger, it's more difficult, a little bit greater risk. Do it in the hospital today with monitoring, external monitoring, and give the mom a dose of terbutaline that will soften her uterus. It'll make it easier to turn the baby. If the mom has a lot of pain, that's a good reason to stop doing the procedure. That's really a warning sign. I've never had that problem. I've never run into the problems you could have, like a ruptured placenta or an umbilical cord that gets tangled up. Those are all possibilities and things you have to talk with mom and dad about. But again, I haven't seen them happen. And when we do the ECV in the labor and delivery, we can monitor that to make sure that if something does happen, we could always do a C-section.
Are there risks in doing an ECV?
Well, there's nothing that has no risk. So yes, there are risks. And I think for the most part, there's probably more benefit than there is risks. But certainly, we do have to worry about injuring the placenta and getting the cord wrapped around the baby's head or something else.
How do you do an ECV?
Well, the simplest thing is, like I said, make sure you get the mom's uterus nice and soft with the terbutaline. I like to do a forward somersault, that is push on the back of the head and then push up on the butt. And I think that works best.
Are there reasons not to do an ECV?
Well, if you have a mom who says, no, I don't want one. If you have a mom who says, oh, I want a breech, oh, I want a C-section, well, that kind of limits your choices. On the other hand, vaginal bleeding would be a reason not to do an ECV. Also, placenta previa would be a reason not to do an ECV.
All right, the best place to go is ruraldocallen.com. And check out ruraldocallenpodcast.com and safepregnancies.foundation.org. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Allen podcast, guys. Take care.